From data to diagnosis, new AI-powered tools are helping doctors detect cancer early and, of course, save lives. Providence Mission Hospital in Orange County is ushering in this new wave of cancer treatment. And to share more about this wonderful program this morning, we're joined by Sandra Brown right there. She's the Senior Manager of the Clinical Genetics and Genomics program at Providence. And right next to me is Dillon Berg. He's a Senior Genetic Counselor. Good morning.
Good morning.
Thank you both for being here. No, it is our pleasure. We're so thrilled to have you guys talk about this wonderful new program. And for folks who have not heard about it, basically tell us more about what is Precision ForMe and what makes this so unique compared to other genetic testing.
Well, Precision ForMe is a program. It's like a platform that we've developed where we can combine the best in our science with the best in our technology. So we're able to use the incredible advancements of science in genomics in order to provide genetic testing, and we're able to provide the very best in technology by being able to identify every patient with a new cancer diagnosis and reach out to them directly and send them information at their home and invite them to participate in having genetic testing. And so it makes it really a seamless process, and it allows us to reach directly out to patients and make sure that they're getting the information they need right away at a really difficult time when they're just first diagnosed with cancer.
Yeah, you guys, Sandy, Dillon, I think a lot of people out there are wondering, you know, could I be a candidate for this program, especially if you've had friends or family who've had cancer, died of cancer, dealt with cancer. You may wonder, am I going to get cancer? So who's the typical candidate who can take part?
That's a great question. I think there's a lot of people who qualify for genetic testing and maybe don't realize it. It's always a good place to start by talking with your family members about cancer diagnoses that exist, and then talking with your doctors or speaking to a genetic counselor to get more information. But Precision ForMe was really designed for the cancer patient. Like Sandy was saying, to give information to them at a really critical time in their life.
Got it.
So by screening all of these new patients who are diagnosed with cancer, we can utilize the tool with Precision ForMe to get information to the people who are most likely to benefit from genetic testing, so it can be there to help them make the right treatment decisions moving forward, better understand their future risks moving forward, and really give information to their entire family.
Amazing. For the patients who are now going through this program, can you explain to us what their reactions have been so far?
Well, so far we've had really positive reactions. So my role has been to really develop the platform and to provide the clinical expertise to develop the program. And Dillon's role is to make sure that that program is being properly released at our clinics. And so all of our clinics in Orange County now have the ability to identify every new cancer diagnosis. So we automatically are seeing every new cancer diagnosis. We're able to screen them and send the patient a notification that they're being identified as someone who would benefit from having genetic testing.
I read it in an article. Someone who went through it believes that this really helped save their life.
It absolutely did. He was diagnosed with a rare type of skin cancer called a sebaceous skin cancer. And it was removed and he was able to move on. But in identifying this type of cancer, we were able to see, we know that this type of cancer is associated with a genetic condition called Lynch syndrome, which increases the risk for several types of cancer. So he was pulled in, able to get the genetic testing that he needed, and it did confirm that he had this predisposition, really. And because of that, we recommended a few different cancer screening and preventative measures. One involved a test of his stomach and found that he had this very early form of stomach cancer that he was able to have removed and able to be treated successfully. So certainly we don't know what the future would have held if he didn't have that information, but it absolutely made a difference.
You know, we were talking about during the break, here's an example of AI being used for good. You know, what does it feel like for you guys to know, the role you're playing, the role Providence is playing in helping save lives here?
It's truly exciting. It really is. As we were talking about during the break, my dad died of cancer a little less than 20 years ago, and there was none of this kind of technology available for him. There was no precision oncology. There was no way for us to use technology like AI tools to reach out to him or to identify him. So the amount of change that we've experienced and what we can do now is so far advanced from what we used to be able to do. And we also have this kind of technology right now where we send a questionnaire to every patient having a mammogram. and every patient having a colonoscopy. So we don't want to just identify patients when they have cancer, although it's really important to know what's driving a cancer. So it's important for us to identify people with cancer, but we're also identifying people who have a high risk of developing cancer. And we want to identify that risk before they get cancer so that we can work on prevention, risk reduction, and also let their families know that they could be at risk as well.
Yeah, to those who may be predisposed to cancer.
Exactly. Yeah.
Well, as I explained before, I lost both my parents to cancer, so this is so meaningful, a meaningful discussion to me, and I'm sure for so many people out there. Thank you both for what you do, and I know this program is going to be so successful, so thank you again.
Of course.
Thank you
so much for having us.
Yeah, our pleasure. And for more information about exactly what they're doing for Precision ForMe, this program, all of that information is on our website, cbsla.com. Click Seen on TV.